I am Lashonda Hollins with Hollins S.P.E.A.K.S. And I just want to first thank you for jumping on. Sorry that I am a couple of minutes late. Emmanuel is making baked potatoes, and so he was wrapping them in foil, and I did not want like the foil crinkling in the back of my video. So I was like, can you come on, like hurry up? But I have a husband that cooks, so that is a blessing. And so we'll just jump in where I am now. So nonetheless, I just want to first thank you for jumping on and for listening in to everything that I have to share with you tonight. I also want to say that I hope that you and your family are well and that you are making the best of this time right now. I know that it is very uncertain times, but I hope that you're making the best of it, and I hope that you're well, and I hope that your family is well. So tonight, what I am going to be talking with you about is actually Black maternal health and National Minority Health Month. I will be focusing a little bit more on Black maternal health because Black maternal health Week was last week, and I want to shed some light on that because when we start talking about Black maternal health, the mortality rate of Black women, and we start looking at the statistics, it is staggering statistics, and it is something that I feel like we need to discuss. And so I would like to ask of you, one, if you are catching this on the replay, that you put #replay, but also that you share this. If you don't ever share a video from me ever again, this is one that I would like for you to share because it is important to me. It not only affects me, but it affects women in my day-to-day life, people that I'm around every single day. And I can guarantee that the majority of you that are watching my video, it affects you, and it's going to affect someone that you know, because we are a minority. We are Black women. We are Black mothers, and we are the ones that are experiencing this. And so if you don't share anything else, please share this post with your family, with your friends. Just hit the share button here on Facebook and put #replay. And as we go through this, if you have any questions about anything, definitely jump in and let me know. I will say that as we're talking about, talking about Black Maternal Health Week, I didn't know a lot about it. I actually didn't do the video last week, which was Black Maternal Health Week, because I didn't find out about it until last week. And so what I'm going to do is just talk a little bit about Black Maternal Health Week. Then we'll go into some education and some statistics on Black maternal health. I am going to address National Minority Health Month on next week. I actually want to bring in a different type of education for this. I want to talk a little bit about doulas and midwives. And so that's something that I'll be incorporating on next week to honor National Minority Health Month. So I'll be releasing the dates and times for that because I've actually extended an invitation to an actual African-American doula to come in and talk with us about midwives and doulas and what they do and how they can benefit us. And so I want to be able to do a whole segment on that to provide education. And I actually want to bring someone in that can provide more education on exactly what it is that they do and how we can benefit from that. So with that being said, I'm jumping into Black Maternal Health Week. Again, if you're just joining, if you don't ever, share anything of mine, I would really, really like for you to share this post because of the importance of this post and how it affects us as minorities. So first, I'm going to go with some general information. So, Black Maternal Health Week. It was founded in 2018 by a group called BMMA, which is Black Mamas Matter Alliance. And basically, it was designed to spark a nationwide conversation just about Black maternal health. And I think what they're doing is working because they've reached me. And here I am sharing their message with you. So just wanting to talk about Black maternal health and how we are being affected as Black mothers. So I am going to talk with you about pregnancy-related deaths. I'm going to talk to you about maternal death, and I'm going to talk with you about how this affects us as minorities. So first, I'm just going to tell you what pregnancy-related deaths are. So pregnancy-related deaths are deaths that occur in women who, while they're pregnant, during their pregnancy or during delivery, and up to 365 days after the pregnancy. So that is what pregnancy-related deaths are. So whenever you hear me say pregnancy-related deaths or you hear me say maternal deaths, I want you to think about these definitions. So maternal death is a little bit different than pregnancy-related deaths. So when I use the term maternal death, I'm talking about what the National Center of Health and Statistics and the World Health Organization define as a woman who dies during pregnancy or within the first 42 days following delivery, regardless of the duration and the site of the pregnancy from any cause related or aggravated by pregnancy. So maternal death is anytime during and up to 42 days after, and pregnancy-related deaths, which is according to the CDC, is going to be the same thing, but it covers up to 365 days post-pregnancy. So just keep that in mind as we're talking about those. I definitely wanted to give you the definition of the two because they do differ a little bit. So let's talk about minorities. Let's talk about Black maternal health, which is why I'm here with you today. The truth about Black maternal health is that, y'all, Black women are dying. Like, we are dying at higher rates than our counterparts. We are having higher rates of maternal mortality. And so according to some of the statistics that I've found, women of color are 50%, and this is the CDC. So according to the CDC, women of color are 50% more likely to have a preterm birth. And according to the CDC, we are 3 to 4 times higher than our white counterparts to experience pregnancy-related deaths on average in the United States. And so this means that we are 3 to 4 times more likely to die during pregnancy or post-pregnancy. So I want you guys to really think about that, and we'll talk about a little bit later why this is happening or why we see this large number. And so for those who are watching, I want to also break it down a little bit in among each state or some of the popular states. So let's talk about Texas. Let's talk about where I live right now. In Texas, Black women are 8 times more likely to experience maternal death. In Georgia, Black women are 8 times more likely to experience maternal death. And in New York, 12 times more likely. And for my people who are from Mississippi, my home state where most of my family and my old friends are, I was able to find a statistic that goes from 2013 to 2016. And at that time, it was 3 times more likely for Black women to die of maternal death or experience maternal death than our counterparts. And I'm pretty sure that number has increased since then, because based on the bell curve that I saw in doing some of this research, is that since I think 1987, the rates of maternal death in general have been increasing every single year. And so I wish that I could have found a better statistic for you, but even Mississippi with the population that we have, if we're dying at 3 times more of a rate than our counterparts, that is still high. So why are we seeing this? One of the things that I wanted to talk to you about, there are several reasons as to why we could be seeing these numbers. I do want to touch on a few of them. One of them is treatment bias. So what is treatment bias? Treatment bias, and I'm going to read this because I want you to have the actual definition, and I'm paraphrasing as well. So treatment bias is when the form of remediation provided to a patient is determined or impacted by social class or social background of the patient. And so basically we have providers who are treating us or impacted by our social class status or our social background status. And so this leads to treatment bias. This leads to us being undertreated. There's also Black women and women of color are more likely to experience we're more likely to experience being ignored. We're more likely to experience being unheard. Our health concerns are not taken seriously. This is something that we are experiencing on a more and more frequent basis. There is also this false belief that Black women have a higher pain tolerance than our counterparts. And so oftentimes we say, oh my goodness, I'm in pain, and we're more likely to not be taken serious, or we are expected to be able to, experience a little bit more pain. It's very strange. Manny Mayo had conversations about this earlier because we were processing this together, this information together, and looking at these statistics and these experiences that we as women have, and it's staggering. And when you think about some of the experiences that you've had yourself, you may be able to relate, or you may be able to go back and say, oh yeah, like I remember, that doctor didn't take me serious. You've probably heard me share my story just about my fibroids that I had immediately after my miscarriage. I knew that I had fibroids, and they were large fibroids. And my doctor at the time, or my OBGYN at the time, basically told me, oh, come back in like 6 months. But you just told me that my issue was serious. And so after speaking up and not getting any results, I chose another provider. But we do experience these moments where we're unheard and we're ignored, and sometimes we go silent, and that is not okay, and that is not what we want. So keep in mind that these are things that we're experiencing on a daily basis, and just be mindful of those things. But again, there are so many other reasons that we could be experiencing this. One is also poverty, racial bias, medical racism, all of these things. And to be honest with you, sometimes it can be like treatment biases and things like that can be, the doctor can unknowingly be doing these things, if that makes sense. But it happens, even if it's unknowingly done or being done to us, it happens. And so that doesn't make it right. It doesn't make it fair, because it's costing us our lives. And one of the examples that I wanted to share with you, I don't know if you have seen the HBO special with Serena Williams, but she talks about her experience when she had her daughter. And so I want to share that with you, because for me, just hearing her story, I literally got chills watching her talk about this in tears, because we're talking about somebody who has the money, someone who can afford it, someone who can pay for whatever this is that she's asking for, and she still goes unheard for a significant amount of time. So let me just share a little bit about Serena's story. So basically, Serena had to have a emergency C-section, and according to her, the C-section went well, her pregnancy went well. She really didn't start to have any issues until post-delivery, while she was in the hospital. And while she was in the hospital, she started having shortness of breath. She couldn't really breathe. She couldn't really take a deep breath at all. And I also want to point out that Serena had a history of blood clots. And so she knew, when she was experiencing something that was a little bit off with her body. And so she immediately, not wanting to scare her mom, so she left her room and she went to her nurse, to a nurse's station, and basically said, I need to have a CAT scan. Like, I need to have a CAT scan because I think I'm having a pulmonary embolism. And of course, the nurse, thinking that she is on, medication, she's a little bit out of it, that she thinks she doesn't really kind of know what she's saying or what she's asking for. And again, Serena tells her, no, I have a history of blood clots and I need to have a CAT scan. And so they still don't give this lady a CAT scan. And I'm pretty sure her doctor is also aware of her medical history. And so for someone to hear that you have shortness of breath and you also have a history of blood clots, that kind of goes hand in hand with pulmonary embolism. Like, let's really look at this and take this serious. And so they still chose not to give her a CAT scan right away. They did what she called a Doppler, where they were able to check her body for blood clots. And of course, everything came back negative. They were like, oh, you're good. And she's like, no, why are you giving me a Doppler? And I've asked you for a CAT scan. Like, I need to have a CAT scan. And finally, they gave her the CAT scan, and they actually found multiple small blood clots in her lungs. And so she had pulmonary embolisms, and she could have died. So had she not spoken up, had she not been an advocate for herself, had she not stood firm in what she believed and what she was feeling in her body, she really could have died. And her husband actually talks about how he was fearful that, that she could die and that she wasn't going to make it because she was having a really hard time. And if you haven't seen that, and if you're interested in seeing that, please let me know. I can share a video from YouTube that I watched in the bottom in the comments. But it's a story that really gives you chill bumps, but it also just kind of brings things together for you. It just lets you know that this can be any one of us. It can be any one of us, and it is affecting us minority women at higher rates than it's affecting our white counterparts. There's also statistics that show that Native women and Asian American women experience these same feelings of feeling unheard and feeling not listened to and silenced. So I definitely want to make sure that you understand the seriousness of taking control of your maternal health. And that's one of the things that Black Moms Matter Alliance wants us to know, is that they're on the front lines. They are pushing for different legislation. There's already been legislation passed, but they are also pushing for more legislation, and it's alliances like these. It's not just them that are out there, and they are pushing for legislation that is available to protect not just mothers, but Black mothers, sorry, Black mothers as well. So with that being said, I want to talk a little bit more about what we can do. So we know that these things are being done on a legislative level. What can we do as Black women to protect ourselves from these biases that we can experience as we're going through our pregnancies? So we can advocate for ourselves. So don't ever be afraid to advocate for yourself. Speak up and don't be ignored or silenced. It's so hard. I know it's hard when a doctor comes in and they are talking very matter-of-factly to you, or they're not listening to you, but do not be silenced. Do not be silenced. Be knowledgeable and know what to ask. So do research on pregnancies. Do research on what Black women are experiencing as we go through these pregnancies. So know the warning signs, know your body, and speak up when something is off. So when you know that something is off with your body, don't be afraid to speak up in regards to those things. And one of the big things for me also is empowering each other. So if you know resources, if there are resources out there that you know are beneficial to mothers, beneficial to Black mothers, and you are sitting on that information, you're not helping. So empower and help and share that information, because that is how we are going to beat these statistics that is how we're going to move past these biases. And one of the final things, and I touched on it a little bit earlier in my research, I also found that utilizing doulas and utilizing midwives are so important. And I'm not sure if you know this or not, but doulas and midwives were founded or created by the African American people, by the Black people. And now we are less likely to use them than our white counterparts. Not sure where in history we started moving away from using doulas and midwives, but they are there to help you and to benefit and to provide a benefit to you. I want to, again, like I said, I don't want to go too much into it because I plan to try to have a doula on next week as we're addressing National Minority Health Month to talk about the importance of doulas and midwifery. So just stay tuned for that. I'm going to be sending out some information about that, but that is definitely one of the other things that we can do to protect ourselves is to use doulas and use midwives, educate ourselves on them and determine whether or not we need them. They are there to provide the comfort and to help us advocate for ourselves. So again, if you have any questions that I can answer, if you want to see some of the statistics or some of the videos that I watched or anything like that where I pulled my information and my resources from, I'll be glad to share that with you. I am very open and want to make sure that I'm providing you with the information that you need. I appreciate you jumping on. I appreciate you watching. Again, please put hashtag replay if you're catching this. And again, if you have never shared anything from me and you never plan to share anything from me again, I would love for you to share this video because here I am talking about Black maternal health. I'm talking about our mortality rates when it comes to deaths among mothers who are delivering babies. So I want to make sure that word gets out. So thank you again. I hope you guys are having a good Sunday. I hope that you have something planned good for this evening. Emmanuel has been talking about watching like this Michael Jordan special that's coming on tonight. So he's been talking about it all week. So I think that's what we're going to be doing. If y'all are doing something special, put it down in the comments. Let us know what you're doing. Stay safe out there. Stay social distancing. Keep social distancing. Use sanitizers. Wash your hands. Don't touch your face. All of the things that the CDC is asking us to do. Just stay healthy and stay safe. And if you are a pregnant mother, definitely stay safe. Definitely share this video. We are our sisters' keepers. Y'all have a good day.